Good afternoon, everyone. I would like you to imagine yourself in this particular situation. You're experiencing the worst abdominal pain you could think of. So you rush to your nearest hospital. Once seen by the doctor, you undergo a couple of medical screenings, and later that day you're notified that you need emergency surgery to remove your appendix. But perhaps an hour before your scheduled surgery, your doctor comes and notifies you that they misinterpreted your results and that your surgery is actually to remove your gallbladder. So now let's fast forward a couple of months after the surgery. You start noticing a funky smell and pus coming out of your belly button. So you go back to your doctor and they notify you that you've actually acquired an infection from the procedure. Not only that, but also that you still have a piece of gauze inside you. Hold on a second. You ask yourself, how could have they misinterpreted or misdiagnosed me in the first place? Also, could have the infection you acquired been prevented? And most importantly, could have that medical error be prevented? Ladies and gentlemen, this is exactly what happened to my mother a couple years back. Preventable harm in healthcare is a public health crisis. And according to CDC, it is one of the leading causes of death in the United States. It also accounts for more than 250,000 deaths per year. So this leads me to my question. What can be done to reduce misdiagnosis, healthcare-associated infections, surgical errors, medication errors, and increase patient safety? So potential solution is having the National Patient Safety Foundation, NPSF, to urge healthcare leaders along with policymakers to work collectively to ensure widespread adoption, evaluation, and have greater collaboration among one another. So you see, in doing so, we will have collective efforts to improve patient safety and address preventable harm across the healthcare system. By implementing a national action plan, we would accelerate this progress in preventing harm and address this challenge consistently. Most surprisingly to know is that 1 in 25 inpatients have an infection related to hospital care. So obviously this leads to tens of thousands of lives. But by appointing this approach, it is already we already see a significant reduction in healthcare-associated infections. Also, according to a 2016 report from NPSF, errors and injuries that occur during care may cause significant mortality and can undermine patients' quality of life. And even with ongoing efforts to improve patient safety, visible improvements is still inconsistent. This means that hospitals can adopt these efforts while others don't. And also there's a lot of finger pointing between multiple sectors. So in order to really achieve patient safety, stakeholders should work together to anticipate risk and uniformly apply coordinated prevention efforts. Now, another potential effort in tackling this healthcare problem is identifying causes and intervention. So in order to do this, a recommendation action would be to provide sustainable funding for research in patient safety. In other words, to ensure that funding for research on the prevention of healthcare is at a level comparable to research on other top diseases. So for example, in 2016, the National Institution of Health allocated $5.4 billion for cancer, while just allocating less than $1 billion for patient safety. So this particular solution will help because we're essentially tackling the root of the problem. You see, in essence, if we were to ensure proper funding for research on identifying the causes of healthcare-associated infections, medical errors, and injuries, we have the power to decrease mortality rates among patients and thus ensure quality of life. Medical errors can occur anywhere in the healthcare system, but even if they were unintentional, they can certainly be preventable. It all begins by creating a centralized and coordinated oversight of patient safety. By initiating a coordinated public health response, will essentially accelerate progress in the prevention of harm and ensure a better quality of life. In addition, by investing money in research and patient safety and prioritizing this issue, we will be more than capable of identifying causes and intervention that work. In return, we can minimize and ultimately eliminate certain medical errors and injuries. So it is important that we realize that each of us will be patients during our lives, and whether we are interested or not, we carry the sense of responsibility for improving safety within our healthcare system. Thank you for watching and listening.